we have our special guest, and that's Dr. Anil Singhvi. He's going to inaugurate our webinar. He's graduate and postgraduate in medicine from Pandit Jain Medical College, Raipur, postdoctoral training in hematology from Bombay Hospital, Mumbai, followed by a 3-year stint at demonstrator at CMC Hospital, Vellore, where he worked both in the clinical side as well as the hematology lab and blood bank. He did short visiting fellowship at the Memorial Sloan Kettering Cancer Center in New York in leukemia and lymphoma unit, as well as the Cornell Medical College in the hemophilia unit. He started a hematology center in Indore in 1991 with self-contained lab, blood bank, and the daycare center. He has been attached to the Chaitram Hospital, Bombay Hospital, and CHL Hospital in Indore on an honorary basis. I request Dr. Anil Singhvi to inaugurate our webinar and give her words of wisdom for our junior colleagues. Thank you, and over to you.
Thank you, sir, for those kind words. You really take me back in memory lane 35 years back almost, when I started my journey in hematology. So just a few things which I have learned through the years, through my experience, and just 3 things I'll mention. One is that I should begin with the equation that treatment equals medicine plus doctor. The medicine part we all learn, and we are still learning fantastically through sir's efforts with all these webinars and other things at our disposal. We should also focus on the right side, the second half, that is the doctor or the doctor's team. Now tell me, how many of you have had that kind of experience where patients with sickle cell anemia come to you and they have been seeing a pediatrician or a general doctor, and they have been receiving hydroxyurea, they have been receiving folic acid, all the other stuff. You probably prescribe the same, maybe tweak the dose a little bit, but after they have seen you and they start following up with you, they start doing much, much better. They don't get that many crises, and generally they do very well. So what has happened here? That is the difference is there, because here you were able to sit with the patient, you were able to look him in the eye and tell him that, okay, you are going to get better. And you were able to counsel the patient regarding compliance with the treatment and everything else. So this counseling is extremely important. And I think this counseling is extremely underrated. If you don't do your counseling properly, they will never forgive you. But if you do your counseling right, they will never forget you. So that is the first part of the thing, the doctor thing. The second part, I think, is the human touch. It's extremely important to have some kind of a touch with your patient on a human being to human being level. For example, what I still do after so many years is I still do all the venipunctures for all my patients in my daycare unit myself. Even though we have a nurse, but I still do that myself. And all the other procedures like lumbar punctures and bone marrows, everything I do myself. That not only allows me to hone my skills still, but it somehow there develops a kind of a bond between you and the patient. And the patient really, really is very grateful for that. And sometimes when they go to the hospital, they ask me, why don't you come and start the IV, which obviously I can't do. You have to find your own ways to do that human touch, maybe hold his hand when you're doing rounds or something, but that has to be there. The third and final thing, which I think is always give them hope, give them a positive outlook. No matter what has happened, no matter how many relapses have happened, always tell them you will get better. There's a chance that you will get better. And you're not telling a lie, because as you know, miracles do happen and they will only happen, but if you expect them to happen. So always have a positive outlook for the patient and then do your best for the patient. That's all, sir. Thank you, sir, so much for your guidance all through these years.
Well, thank you so much, Anil, for those lovely words. For our junior colleagues, I must mention, everybody else knows you very well, that Anil Singhvi is an extraordinary person. And the definition of an extraordinary person is that he's an ordinary person with extra skill. As he just mentioned, he is very, very passionate about his patients, about hematology. I had an opportunity to visit his center, and I had gone there for 5 minutes, but I spent half a day with him looking at various aspects of facilities that he has created. So thank you so much to this extraordinary person for sparing his time from his teaching activity or vacation in Nepal. Thanks for joining us. And God is great that you got the network properly and you could speak to us.